Haldimand-Norfolk shared a very brief statement this afternoon, simply saying that the UK variant had been identified in the area. Besides reminding residents to stay home, wear masks, and wash hands, the region's Health and Social Services group didn't offer any more details. The region's point person told CHCH that in an effort to protect medical privacy, they could not detail where the variant was first contracted. They also didn't answer how many people had been infected, whether they contracted it via travel or community spread, or if those close to them have been contacted and instructed to get tested or to isolate. This comes as a Simcoe Muskoka District Health Unit confirms that it has 10 cases of the UK variant, with potentially more coming.
We have a further 105 persons who have screened positive, knowing that there's still a second test that will confirm variants as well as potentially the UK strain.
Roberta Place in Barrie has been hit hard by COVID-19. 50 residents and 1 staff member have died.
Highly contagious strains of the virus have entered our country.
In response to the steadily increasing case count, the Ford government announced a 6-point plan to limit the strain's spread, starting with mandatory testing for international arrivals at Pearson Airport on Monday.
We're moving to quickly build the lab capacity to screen all positive COVID samples for variants within 2 to 3 days of initial processing. Any lifting of public health and workplace safety measures must be considered very carefully until more information on variant spread is known. We'll strengthen case and contact management efforts for all COVID-19 cases. This will enhance the province's capacity to identify known and emergent variants of COVID-19.
The province will also look to speed up vaccinating vulnerable people in long-term care homes. And when asked by CHCH Queen's Park producer Randy Rath about the medical officer of health's previous prediction that restrictions could begin to be lifted once we get to less than 1,000 cases per day, Dr. David Williams says those numbers were based on the regular COVID-19 and that the variant complicates things. He says ICU numbers need to be kept below 200 in order to make room for a possible surge of the UK variant come March.